On the 24th March 2014, the African Union Commission will join member states in making a call for renewed continental action and global solidarity to ensure that no one is left behind in the fight against tuberculosis. This World TB Day, we share our solidarity with the global efforts to find, treat, and cure 3 million people and accelerate progress towards zero TB deaths, zero new infections, and zero stigma. In Africa, the TB treatment success rate has continued to improve, reaching 82% in 2012. The previously increasing incidence of TB has been halted, and a decline observed as a result of several years of intensive implementation of global and continental efforts, as well as the strengthening of TB-HIV collaborative activities. Over 75% of TB patients in the high HIV endemic countries of the Eastern and Southern African sub-region were tested for HIV, and nearly half accessed ARVs in 2012. However, Africa is the only region in the world not on track to achieve a 50% reduction in TB mortality by 2015. 6 out of the 11 high-burden countries which are not on track to reach one or more targets for reduction in TB incidence, prevalence, and mortality in Africa. The continent still accounts for 24% of the world's TB cases and is home to nearly 80% of TB cases among people living with HIV. The high TB burden in Africa is linked to poverty, TB-HIV co-infection, and multi-drug resistant TB. Only 1 in every 5, that's 19% of people affected by multi-drug resistant TB, know their status. We are at the critical crossroads in the fight against TB. While we are the closest we have ever been in defeating TB forever, we are facing a major funding crisis. Impressive progress over the last 5 decades shows that TB can be stopped with strong political will and adequate financial resources. New tools are now available with which to accelerate progress. The reasons for acting now are compelling. Every $1 spent on TB generates $30 through improved health and increased productivity. Fighting TB is a prerequisite for fostering economic growth, ending poverty, and improving livelihoods. Accelerated action to integrate TB and HIV services in African countries, where co-infection rates are highest, will lead to substantial and cost savings and improved health and economic outcomes. This year, our campaign theme is Africa's responsibility to reach everyone in need of a TB test, treatment, and cure. This is a renewed call for Africa to increase domestic financing for TB. On average, African governments contribute 30% of their national TB budgets, whereas in the rest of the world, governments contribute 70% on average. To reach everyone in need of treatment, care, and cure, we need to increase the domestic investments. The successive Abuja declarations, which were renewed in the 2013 Abuja +12 Special Summit on AIDS, TB, and malaria by our African leaders, demonstrate high-level commitments that need to be translated into action. The African Union Roadmap on Shared Responsibility and Global Solidarity for AIDS, TB, and malaria provide the framework to translate these commitments through a well-defined development cooperation framework that is not only African-sourced, but result-based. With less than 2 years left before the deadline of the 2015 Global TB targets, it is our responsibility, with the support of our friends worldwide, to ensure the end of TB deaths, infections, suffering, and stigma. God bless Africa.